Well, for more discussion on the severity of mental issues among young people, we're joined by licensed clinical psychologist Andrew Schwehm from New York. Welcome back to the show.
Hey, Rochelle, thanks for having me back.
So help us understand, why are 18 to 24-year-olds being impacted this severely when it comes to their mental health during COVID?
Yeah, it's a shame to see. What you're looking at is that age group is incredibly vulnerable to heightened levels of stress because they're at an age where they're just going to university or just getting out of university, heading into a workforce that there's a lot of decline in terms of the employment. And there's also just a lot of unknowns in terms of what's going to happen over the next year. And so you're talking about a real increase in the number of levels of uncertainty heading into those times. And that's just going to increase the levels of depression. That's going to increase levels of stress. And as the report mentioned earlier, that it's going to increase levels of thoughts of suicide.
So as you mentioned then, a lot of these major milestones being disrupted, whether you're attending or graduating from college, you thought you were entering a solid workforce for the first time. Talk about the long-term potential impact when it comes to managing their mental health, when it comes to their education and careers.
Well, what you'll see is a cumulative effect. So the earlier that these things onset, the longer course that you're looking at them having. And so we have this measure or this method called the diathesis stress model. And what it looks at is the level of stress that a person kind of comes into a situation with in their predisposition to mental illness. So it's really helpful, especially for young adults, to look at, I have a certain predisposition to anxiety, and if my level of anxiety is already heightened in a situation, then that's just going to put me over the edge. So stressors like COVID pandemic or uncertainty about employment is going to put these things over the edge. And the problem is that this pandemic is hitting hardest minorities, and minorities are typically already at heightened levels of potential for mental health issues.
So then when you do fall into more than one of these high-risk groups, whether you're a young adult who's an essential worker, as you mentioned, members of minority groups disproportionately bearing the brunt of the pandemic, or if you have pre-existing mental conditions, how do you address these risk factors?
That's a great question. You know, one thing that's important is for you to have somebody to talk to. Everybody needs to have somebody that they feel comfortable going to, whether it's a friend, a colleague, a parent, somebody in their life that they can feel comfortable going to talk about what's going on. One of the issues, though, that we're running into is a real lack of availability of providers. Right now, a number of my colleagues are completely booked. And when you're looking at these young adults, a number of them don't have the money to be able to pay out of pocket. And so they're trying to use their parents' insurance, or some of them might be on, say, Medicaid. And right now, the federal government is looking at slashing Medicaid rates, reimbursement rates for providers by 10%. And these are all factors that keep providers from taking their insurance or taking Medicaid and Medicare. And so you're looking at a lot of a paucity of providers there for this population, which is, I think, you know, in the long term is going to run us into a lot of issues.
So as you mentioned, if there aren't enough specialized professionals to meet this growing need, then are there any sort of alternatives or resources that are out there for people who either are struggling themselves or see a young adult who perhaps might need some resources?
Of course. There's a lot of online resources that people can go to, a number of websites that people can kind of have that'll help them out. If you just kind of Google mental health resources or anything of the like, you'll come up with a number of very, very helpful websites. There's a lot of apps out there that practice things like mindfulness or kind of thought restructuring, thought changing. These are all techniques that you learn in therapy. It's obviously best to have somebody, a licensed professional, help you with those things. But if you don't have the resources, there are, you know, a number of workbooks that you can purchase online that you can do on your own that might be able to help you. On top of obviously doing things to take care of yourself, you know, engaging in pleasurable activities like sports or exercise, or just taking a nice walk, or spending, you know, socially distanced time with friends, or whatever you can to keep your mind off what's going on right now.
Now, some of us may not be able to recognize if perhaps we are going through some issues, so there is a lot of nuance in how these conditions are defined. So help us understand the difference between some of these clinically recognized forms of anxiety versus, say, irrational panic, and the best ways to manage each.
So I think part of the difficulty right now for a lot of people is that a lot of their thoughts, a lot of their fears are based in reality. When you're looking at, you know, thinking about, am I going to get a job, or am I going to catch COVID? Those are very rational fears. But the question is focusing on those helping me in any way? And so when you start to hyper-focus on these things, then you're starting to look at it's becoming a little bit less based in reality, because you start to distort certain facts of it. Like you might start thinking that your chance of getting the coronavirus is higher than it actually is, or that your likelihood of being laid off is higher than it actually is. And so when you start to hyper-focus in on those things, that's when you start running into sort of irrational levels of panic and fear.
And just very quickly, I want to get to this issue of stigma. I mean, we've seen a lot of high-profile people speak out about their mental health struggles. Are we really seeing a real acceptance when it comes to speaking more comfortably about mental health? What's the reality?
Yes and no. I think we're getting there. We still have a long way to go, and it's great that you have people, celebrities or well-known people in communities starting to speak out. I definitely think that there's still certain communities where talking about mental illness is not necessarily top of mind, and there's a lot of, like you mentioned, stigma against that. And I think that working with those specific communities, it's typically minority communities, working with those communities is going to be incredibly important to normalize what people are going through so that people don't feel so alone. I think the biggest thing is that when I talk to a lot of my clients, I talk to them about this other person said the same thing 2 hours ago in a session that I just had with you, and the relief on their face, it shows how great it is for them to hear, okay, this isn't just me. I'm not going through this alone.
Certainly important. We do appreciate your insights. Andrew Schwehm, licensed clinical psychologist.